Namaste. I'm Dr. Bindu Menon. I'm a neurologist from Apollo Specialty Hospitals, Nellore. Today we are going to talk about post-stroke complications. Stroke can have several physical and mental complications in a patient. Stroke affects every person differently. It all depends upon the size of the stroke, the site, which area has been affected, the age of the patient, the other comorbidities, how much the patient has taken the treatment, how fast the patient has taken the treatment, and so on and so forth. But it is always better for a person and his caregiver to know that what are the complications later on in period of life the patient can have. One of the most important complications of stroke later is pain. Most of the patients who have had a weakness of one side of the body commonly complain of pain on that part of the body, and it is usually on the shoulder side as well. This is because after the stroke, if there is not a proper physiotherapy and rehabilitation which has been initiated on the patient, the hand goes into a stiff posture like this, and the patient can even develop contractures. Contractures means all the tendons and ligaments and the muscles become very stiff and they attain a posture like this. So that can lead to pain in the limbs. It's usually in the upper lip, it can be in the lower limb as well. Sometimes if the patient has got no power in the limbs, that is the hand is zero power, so that when the person is made to mobilize and the patient is walking, the hand tends to slip down. So there is subluxation at the shoulder. So for both of these, if we take care from the very beginning, the physiotherapist, if they are in contact with the physiotherapist, for contractures, not to develop the contractures, not to develop the spasticity and not to have pain, it is important that the person does full range of movements of all the joints. It should go till 90 degrees, it should go, and even the wrist and the fingers. So every time when the physiotherapy is done, the full range of movement should be there. The contractures, if one sees that the contractures are developing, then they should consult the neurologist and the physiotherapist, because there are certain medications which can be initiated and some splints can be given which can keep the hand in a particular form, especially when the patient is sleeping. As far as the subluxation part is concerned, when the patient is being mobilized, when the patient is made to walk, then they can have a sling as well for that, so that the hand doesn't get pulled down and there is no subluxation. That is regarding the pain. The second is, if the patient is bedridden, then there can be complications of bed sores. So it is very important, if possible, if the patient is completely immobile on the bed and bedridden, then the caregiver can take an alpha mattress or keep changing the position of the patient so that the patient's skin is not at a pressure with any of the bed surfaces for a long period of time. The other complication is deep vein thrombosis, that is the blood in the legs, that is especially in the calf, in the blood vessels, they get clotted there. Again, it is because the patient has been kept immobilized for a long period of time. So it is very important that they do passive movement of the limbs, that is they keep extending and flexing the knee as well as the ankle, and again physiotherapy and rehabilitation helps you for that. Another complication after the stroke is depression and loss of memory. Having said that, we can understand that a person who has been extremely active, suddenly when he develops a stroke and he gets bedridden or he is immobile to an extent that he is not able to function his daily activities or not able to go to his office or his regular work, then a person will get depressed. But then, having said that, from the very beginning, if we have a holistic approach to the patient, not to confine him into a room, get him to where everybody is sitting, taking him out if they can be mobilized in a wheelchair, and making him participate in several activities, day-to-day activities, and trying to get him back to normal as fast as possible, then it would be very useful. Some patients can have memory problems. As I said in the beginning, it all depends upon the site and the size of the stroke and which area has been affected, and that too, it can have language problems, so it can lead to language problems as well. So for that, speech therapists and occupational therapists are there, and one should get in touch, and if it is very severe, there are medications for them as well. Stroke patients should take care that they should not fall. So most of the times what happens is a little amount of mobility when they achieve, they try to get back to their normal life. So they become a little more active and then tend to slip, and then they fall, and then they have a fracture, and then they get back to where we have started. So it is very important that we take care and go step by step and go steady manner and take the physiotherapist help and get back to your normal life. Thank you very much.